Early in the rollout, there were concerns people in their 20s, like these getting vaccinated in London, wouldn't come forward for the jab, given their chance of getting seriously ill from COVID was so small. Well, that's certainly not the case at this GP practice.
The demand for appointments is unbelievable. We were so pleasantly surprised that we've had to increase our Pfizer orders over the last few days.
Just as well, in all regions of the UK, cases of the Delta variant are on the rise. The nationwide REACT study, which tracks infection rates in England, finding today the outbreak still accelerating. The number of cases highest in those who aren't yet vaccinated. That's young adults and school-aged children. From tomorrow, everyone over 18 will be invited to come forward and get their first COVID jab. And looking at today's infection data, that could do a lot to reduce the number of cases of the Delta variant. But it also raises an important question: should children be next? Vaccinating teenagers would certainly drive down infections. It could also benefit their education. The latest rise in cases causing yet more disruption to thousands in school.
I mean, it's incredibly disruptive. It's at a time when we're trying to bring back some sense of normality to the school. We're establishing rhythms and routines back in the school year. And any disruption is something that we have to cope with and we all have to bear with, but it's not helping us maintain and return to what are the routines of a normal school day.
But given the risk of COVID to healthy children is so low, it's unlikely routine vaccination will be recommended anytime soon.
We need to think through clearly why we're doing it, and we will almost certainly be vaccinating teenagers and children to benefit others, to benefit older adults. And that needs careful thought. To do that, we need an incredibly high bar for safety.
Children over 12 are receiving COVID jabs in the US and Israel, and safety data from there will inform any future decision. For now, the race is on to vaccinate every adult before COVID gains more ground. Tom Clark, News at 10.